My name is Dr. Austin Foster. I'm a visiting professor of orthodontics at the University of Iowa College of Dentistry and Dental Clinics. So when I was 14 years old, our dentist told my family it was time for me to go see the orthodontist. Started that process, had my braces for about 2 years, and for the first year I really wasn't that interested in what was going on. I just had braces and that was kind of it. And then I noticed that teeth were changing, looking a lot better. I started asking the orthodontist a lot of questions like, what are we doing and why are we doing this? And he was really nice. I enjoyed going to see him, answered every question I ever had, and I really got interested in it. So I decided to be an orthodontist when I was about 15 years old. I went to dental school never wanting to be a dentist, which was, that's a questionable life choice maybe, because had I not gotten into orthodontics, it maybe wouldn't have been good. Once I was in dental school, I liked things like oral surgery, endodontics, but I really didn't ever find a true love for crowns and dentures. But I got into orthodontics and it all worked out. Probably 80% of the people I treat are children, so anywhere from age 8 to 18. I will talk to the parent to the extent that I need to for consent and so they understand, but once I've kind of communicated what's going on to the parent, I generally engage almost completely with the patient. I try and really get the child involved in what's going on so that they feel that they have a positive experience, not just with the result, but with the entire treatment experience. If the kid kind of feels like they're on the team with you, the orthodontist, and you and the parent aren't doing things to them, you, the orthodontist, are working with them specifically and their plan to get them the smile that they want and that they deserve, they'll tend to get on board with that more than if they feel like their mom is making them do something. I really focus both on the results and the process. So every time I see the patient, I'm upbeat. I say, how's it going? What's going on at school? I truly get to know them, and so I think most of my patients understand that, yes, I mean, they're there to get a good smile. I'm going to get them that, but I really like when the kids like to come see me, and I work hard to make that true. People will come in to the orthodontist for a lot of reasons. A significant portion of people come in because they are self-conscious about their teeth or their bite, and they maybe don't like to smile. And so you give them a smile that they can take to their wedding, to their graduation, and that smile that you give them is with them forever. I would say by far my favorite part is at the end, I'll give all my patients a before and after photo, and I just like to look at their face when they see how their teeth were before. It happens subtly, like they have the braces on, things happen slowly. It's generally a 2-year process. And then when they go back and they look, they usually turn really red, and then they look away from the picture and they start laughing, and that is my favorite part of my job. The most rewarding part of teaching the residents is just really preparing them for 30 years of being a professional and being a colleague. We have a really unique program in that it's 2 years, it's highly clinically focused. Within a month of being here, you're treating patients. There's very little downtime. Even within like the first 6 months, you see them blossom, and they're basically an orthodontist at that point. Like they can answer 90% of the questions you'd ask them. Last 18 months of their program, I mean, they turn into a true colleague. And just seeing somebody grow that much professionally, personally in 2 years is probably my favorite part. I know all the faculty here, myself included, we really have a lot of respect for our profession and for those who came before, and we have a really high regard for the type of resident that we graduate. And so knowing that we're contributing in that way to the specialty is really rewarding. It is a nice blend of having different faculty here with different experiences. So there are full-time faculty that this is what they know and they're here every day. Dr. Southard, Dr. Moreno, Dr. Shin, Dr. Callan, they're all, the full-time people are very focused on making you an excellent clinician, and they will do that. And there are guys like me that come in 1 day a month, 2 days a month, 3 days a month, and we bring with us our experiences that we have outside at our own clinics. How do you interact with staff? How do you hire? What kind of patients are you looking for when you're out there, and who do you want to treat? What kind of practice do you want to have? And I think that's highly valuable. I consider myself extremely lucky that I got to go to dental school and orthodontic residency here. I did rank Iowa first in my match. I got it, which was lucky. I mean, that's what I wanted, but it is the best decision I've ever made.